Hello. I just want to talk to you for a quick minute about the use of anti-inflammatories. Since you probably know by now that the typical anti-inflammatory drugs used for arthritis actually contribute to the destruction of the joints, you're likely wondering how we decrease inflammation without causing other problems. Well, there are a number of natural agents that have anti-inflammatory ability. I'm going to dwell on just one of them right now, and it's mostly to illustrate how people's thinking is influenced. You see, doctors and the public alike have become brainwashed as to the relative worth of different substances. Aspirin, of course, is the oldest and most widely used anti-inflammatory and pain-killing drug. But it became popular before the drug houses started patenting drugs right and left and requiring a prescription. So because aspirin can be bought over the counter, and doctors were increasingly influenced to prescribe the newer and more profitable drugs, aspirin came to be looked upon as a poor cousin to such drugs as sodium naproxen, indomethacin, and the like. But yet, if you look at the studies in medical journals, you'll find that lowly, cheap aspirin performs pretty consistently, outperforms, in fact, the newer prescription drugs. In fact, a clinical study found that white willow bark, which is the source of aspirin, outperformed ibuprofen. That's right, the herbal product, not even the refined aspirin, relieved pain and inflammation better than the usually recommended drug. People who consider themselves educated and well-informed have come to believe that nothing that grows in their backyard could possibly be the equal of a synthetic drug. Real drugs are made in test tubes, they think. And they act like you're crazy if you suggest otherwise. Well, if it's a willow tree growing in their backyard, or a number of other plants, like the hated dandelion, they are just dead wrong. Powerful medicines exist in nature. They can be very effectively and very cheaply acquired. And just because drug companies don't want you to believe it, doesn't make it so. And the things I'm telling you are not the wishful thinking of a different medical camp. There have been studies done by reputable institutions and published in peer-reviewed medical journals that confirm what I'm saying. Your doctor may not know that because he or she didn't go looking for it. And it's human nature to think that if you haven't heard about it, it doesn't exist. Now, back to natural anti-inflammatories. I'm going to focus on one that fits this situation of being effective but so common you wouldn't believe it works. It's an enzyme called bromelain. It's one of the major enzymes contained in fresh pineapple. Enzymes are protein substances found in foods that are catalysts for reactions and are used by the body for rebuilding tissue. They aid in digestion. They allow your body to absorb the nutrients in the food that you eat. They assist hormones in getting where they're supposed to go. And they can clean up a lot of debris in your bloodstream. Specific types of enzymes act on specific types of food. Bromelain assists the digestion of protein in the body. Bromelain reduces swelling and inflammation and actually helps protect against infection. It also dissolves accumulated fibrin, and that's why it's important to us in the treatment of arthritis. During the inflammatory process, a plasma protein called fibrinogen is transformed into a partially polymerized soft protein called fibrin. Now, bromelain depolymerizes these deposits, so there's increased drainage and fluids can travel more readily in and out of the vessels. Bromelain also dissolves trapped blood proteins because, guess what? It helps digest protein in your stomach. So I recommend that my patients eat fresh, uncooked pineapple between meals. When there's no food to digest, the enzymes go to work on other proteins, the ones that are causing you problems. The interesting thing is that while bromelain dissolves fibrin, which is how your blood clots, bromelain doesn't disturb the normal clotting ability of the blood, so it doesn't pose a risk to those people taking blood thinners. As you might suspect, enzyme therapy has been found effective for a number of conditions that are characterized by fibrin concentration and swelling, like sprains, surgical scars, wounds, and cellulitis. So now we get to the part where you say, sounds good in theory, where's the proof? Well, bromelain was investigated back in the 1960s as an anti-inflammatory and was reported on very favorably. A 5-year hospital study was done with 700 patients with inflammatory conditions, including arthritis. There was a dramatic reduction of pain and inflammation, increased mobility, and a quicker return to normal activities. The time between admission and release from the hospital in such cases was found to be reduced by bromelain by 30 to 50%, and there were no toxic effects reported. This was noted by M.G. Chiarelli, MD, in the June 1967 volume of the journal Clinical Medicine. A few years earlier, in 1964, there was another clinical study involving arthritis patients and bromelain, conducted by doctors Abraham Cohen and Joel Goldman. Using bromelain for soft tissue inflammation, they had a 72.4% success rate, and this was published in the Pennsylvania Medical Journal. In some cases, they used steroid drugs, and the swelling still did not go down until they gave bromelain in addition. Now, that's something that grows in somebody's yard that seems like a pretty good drug to me. Of course, in the last 40 years, everybody didn't start prescribing pineapple because of this study. And if they had, someone might have found a way to make pineapples a prescription-only item. Now, in addition to using fresh pineapple, and remember that if it's cooked, the enzymes are destroyed, so don't try eating just canned fruit cocktail. In addition to using fresh pineapple, I also use concentrated bromelain in capsule form, which is easier and more convenient, although a bit more expensive. Nutraceuticals are available today that weren't even thought of in the 1960s when these investigations were going on. So in between pineapple snacks, we can swallow a couple enzyme capsules and continue the internal work of clearing out all that tissue-clogging fluid and trapped proteins that are causing us pain and swelling. And remember, no side effects. Thanks for watching.